Okay, so we're doing laser assisted lipolysis. You see that laser light right there? You see it? And so that what is laser means light amplification, stimulated emission radiation. What that means is, like, I don't know if you ever like aim the sunlight through a magnifying lens and then burn a paper. That's exactly the laser principle. So it's amplified light that converts light energy into thermal energy, and yeah, it can burn, right? So that's why the smart part of it is that the computer has a temperature measurement so that the computer will shut itself off at a given temperature so that we don't burn the patient. Burns can still happen, but the light stimulates has a activating site on the it's a little complicated, but it basically the laser light hits the hemoglobin, which is part of the blood, right? And it constricts the blood vessels, so there is less bruising, less bleeding, and a faster recovery when we do this with laser. Also, the laser melts the fat. It's like you have fat or a bar of butter in the fire, and it melts, right? And then it's easy to aspirate, and also the most important thing, it causes maximum skin retraction. Thank you. Okay, so look at that. What do you see?
Yellow fat.
Yeah, yellow beautiful fat, huh? So what we're doing now is power assisted liposuction. We're doing the inner knee right now, but notice that fat is incredible. We're not even gonna do a fat transfer to the buttocks or anything like that. This is just the fat that we are aspirating, and this is the way we do it, right? In a completely bloodless manner, right? But if we were to put fat like this in the buttocks, imagine, that fat will be retained because there is no bleeding. And what we're transferring is pure fat, not fat and blood. Obviously, if you transfer fat and blood, it would look red or it would look pink, right? That's because of the staining of the blood, and that means that it's not pure fat, right? And there are some systems to purify the fat, but we don't use those because we don't need to. It doesn't get any more pure than these. Thank you. All right, so these are the inner thighs, inner knees, and the inner leg there. And notice how there is not much fat here. You gotta be careful with this area because this area is very prone to irregularities. And especially she needs a tight lift. So irregularities happen when there is excess skin. She doesn't want the scars of the tight lift, but this is how much fat we left behind. Not much. Thank you.